So hey everybody, welcome back to the channel. I'm Natalie, Barton, dental hygienist, and this is Dr. Aronson, and we are at Aronson Family Dentistry today in Fort Collins, so you guys should totally come check her out if you were ever needing some information on what we're talking about today. So today we're talking about ozone, and you use ozone in your office.
Yeah.
Can you tell me, like, what is ozone? Let's start with the real easy questions.
So ozone, I like to think of as a super oxygen. It's 3 oxygen molecules together, which is unstable and will quickly break down to oxygen and peroxides.
Nice.
Yeah, so we use it for its disinfecting properties as well as its ability to stimulate healing in the body.
Very cool.
Yeah.
So is this different than the ozone we're always being warned about on TV? We have an ozone alert, everybody.
Exactly, yes.
Different than that?
Very different. So when we make our ozone, we use pure oxygen, medical grade,
So
which
it's not
is
coming out of your car exhaust.
no, it's pure O3. When we have ozone issues in the atmosphere, it's mixing with other particles, and that's where we get dirty ozone versus a clean ozone.
So for those of you that are not in dentistry or not in medical, now you know the difference. Let me start there.
Yes.
So, I mean, you kind of covered this, but why is ozone used in dentistry, and why don't we see it as often? Why don't we ever see it? Like, you're one of 2 offices in Colorado that I've run into in the last 3 years that actually uses ozone. So why is that? Why is it used, and why are we not really seeing it like we should be?
Why are we not? So I would say first, the reason we don't generally see it is because people don't know about it. We're not trained about it in school.
Yeah.
Ozone is actually quite easy to use, not super expensive, and there's no patent on it. So there's not a ton
There's no money to be made.
There's no money to be made. So, you know, there's pushes for other things, but it's a beautiful thing to use. We use it instead of antibiotics in a lot of cases.
Really?
Yes, so we would use it in water when we do surgery, cleaning out the socket, helping kill those germs. We can inject it. So when we do have an infection, we can inject the tissue.
Really? With ozone?
With ozone.
Interesting.
Yep, and the great thing about our ozone generators is we can control the concentration of the ozone.
Okay.
So we have
that on your
all the
yeah, lots of little dials.
yes, lots of dials, lots of concentration differences depending on what we're using it for.
Okay.
But yeah, it's the stimulating, healing, disinfecting. Teeth are very porous, right? And we deal with some really nasty germs that are mainly anaerobes. So an anaerobe is a bacteria that dies in the presence of oxygen. So
Throw
ozone.
3 molecules of oxygen at it.
Yeah, so for what you do, right, with perio, and we have these pockets full of anaerobes, we get that ozone down there, flush it out, it kills it, gives the body ability to help hopefully get that attachment. Yeah, and then restoratively, when I'm looking at dentin is really, really porous, right? The pores are huge compared to the bacteria. I don't want to drill all the tooth out to remove all the bacteria, but I want it sterile.
Right.
So ozone helps me do that.
Very cool.
Yeah.
So for like endo, that kind of stuff, that helps a lot, I would imagine, with that.
Yes.
So how does that compare to, say, using a laser while doing endo?
Both, ideally it would be both. So if we can use laser and ozone together, we're gonna get the best outcome.
Cool.
But if we have one or the other, it's better than nothing.
Right, yes.
Yes, so laser is using light to kill the bacteria, but also stimulate healing. Whereas the ozone gas that we're typically using, or the ozone water, is getting in those tubules. But how far can it get in, right?
Right.
So that combination is what helps.
How did you get started in ozone? Like, where did you discover it? Because you're right, it's not taught in dentistry school. It's definitely not taught in hygiene school. Where did you run across it, and what made you go, I want to use this in my practice someday?
Well, so I am a biologic or holistic dentist, and that is not a specialty, it's a philosophy. So just like the way that I prefer functional medicine for myself, I'd like to know the root cause, and I'd like to have things considered instead of medication. Maybe what can I do to heal the body or get to the source? That's the same philosophy essentially in dentistry. From learning about that, I learned a lot from the International Academy of Oral Medicine and Toxicology, the IAOMT, and I learned about ozone from them. But then I pursued training kind of on my own.
And are there places that specialize in this where you can get training?
So there are trainers for it.
Okay.
And actually, we are really lucky. We have a trainer in Fort Collins who lives here.
Really?
He doesn't host here often, but he and I are colleagues, and we will be hosting some training here. Yeah, because we want
just
the
dentists or for
and hygienists.
And hygienists.
Yeah.
So if any of you are local,
yeah, if you guys
get the word out.
Yeah, let me know if you're interested, because we can always.
I would totally come down.
Yes, we'll probably do it in the fall.
Okay.
But
yeah, boy, if I'm around, that'd be amazing.
yeah.
I'd love that.
Yes.
Very cool.
Yeah.
So how long, is it like a weekend thing or is it just?
It's a weekend thing.
Okay.
Yep, and it's the first day is all the didactic, right? All the science. The second day is hands-on.
Really?
So yeah, having both of those, right?
And I did get to do hands-on today, which was super fun. I did on 2 patients with perio, so that was very interesting. And yeah, it was, the problem with temping though is I never get to come back and see the results.
I know.
Right? That's the part that sucks about temping is
Yes.
I never get to see how it works. But I have talked to people like you guys in another office in Colorado here that, they were saying they don't ever get dry sockets at that office. Their root canals really don't fail, or at least not nearly as often as other offices. What else did they tell me? Oh, they don't have patients calling back after fillings are done for sensitivity.
Right.
Are you seeing the same thing?
I have almost no sensitivity.
It's incredible.
Right. I know.
There are some offices where it's like every patient's calling back going, it hurts, there's something wrong.
Right.
Yeah.
Yeah.
So what does it do that it prevents that? Is there like a numbing thing going on, or is it a bacterial thing that causes that sensitivity?
It's the bacterial. And then also ozone helps stimulate blood flow, which is going to help that tooth heal.
Right.
Yeah.
Okay.
So, yeah, it's great, and it's really not that hard. I mean, you have come in and temped and used it, right?
Yeah.
If we're set up correctly, you can use the little wand, and biggest side effect, right, is you can't inhale it.
Right.
It will cause coughing, so we have to be careful about that.
Yeah. You're suctioning while you're doing it, so nobody's breathing it in.
Yeah.
But yeah, it smells like a thunderstorm, and I kind of like it.
Or like a snowstorm, right? Like fresh snow, kind of.
Yes, that fresh snow. Yes.
Yes.
That mountain snow. It smells like mountain snow.
Yes.
Yeah, that's
exactly.
True. I never thought about that. But what's the best story you have about ozone? Like best thing you've seen with one of your patients, or
It's funny because mine is not dental specific, but this is what made me a true believer.
Okay.
So my husband had to have a mole removed from the arch of his foot. And the post-op care was almost nothing, right? They tell you no cream.
Down there.
Yeah, they don't want a bandage on it. There's no circulation. It's in a sock. It's wet. So by like day 3, it was getting pink. By day 4, it was the pink, it was spreading.
Yeah.
And it was, of course, the weekend. And I'm thinking, I could give you an antibiotic, but how is that going to get to your foot? Like, it takes forever. So we came in and we did ozone injection around it. So I went.
So you didn't just spray it on there. You actually.
I injected because it was clearly an infection. I mean, it was like the red was spreading. So I did injection around it, and by the next morning, it was better. And within days, it was completely healed.
Wow.
And he was kind of, like, okay, whatever your snake oil is,
Right.
he is totally a believer now too.
That's awesome.
It was,
My brother-in-law went down to this other office in Boulder, and he had an eye sty. And they said, well, why don't we just put some ozone water in that? And he's like, I suppose it can't hurt, And they did. They put a couple of drops of ozone water, and the next morning it was completely gone.
Really?
Yes, and he'd had it for days.
I didn't know you could do that, but I mean, that's the thing about it, is there's so many ways to use it.
I talked to a lady, she was using it as a colonic treatment for her cancer, for her breast cancer.
Right. Well, and the gas.
Right,
you can use the gas.
Yeah. Mm-hmm. Yeah. Mm-hmm. And I'm like, what?
I know. Yeah.
So it seems like there's a lot you can do with it, and I would personally love to see it more in dentistry, of course, but just in general.
Right. Definitely.
I feel like it's something like charcoal, where everybody should know how to use charcoal and use,
Yes, exactly.
Have this in your house, maybe. I don't know. Is ozone something you can have in your house?
It is.
Is it?
Yeah.
They sell like a home portable device or something. Is that just for like water? You can drink it, or like how would you work? How would you use it at home?
So it depends on the machine that you buy. The ones we have that have all the huge range of concentrations is a more expensive machine. And it has more dials, right? The at-home machine is usually just one dial or an on-off. If you have the on-off, it's probably just going to be for water, where you actually bubble the water or bubble the ozone through the water and make it ozonated. You can use that for cleaning, laundry, vegetables, skin, you know, all of those things. But if you were cancer,
topical than drinking. Okay.
And you can drink it, but you have to consider, do you want to wipe out everything all the time? Right. That microbiome. Yeah. Do we kill everything?
Emergencies probably better.
Right. Or with maybe a short course. Right. Maybe not an everyday thing.
Yeah.
The other machines, you could get one that you could control the gas, and maybe you do something like the insufflation, like the colonic. And that they have that machine. The company we use is Promo Life. It's a pretty simple machine, but what I love is that they're really good about supporting the customer. So I've had patients who have bought machines, and maybe they need it for like sinus. We're doing a lot of sinus treatment, and the company helps walk them through how to get it, where to get your oxygen, all of that.
Cool. Yeah. Cool. Yeah, and that's what you need, because again, it's not a new technology, but it is because nobody's familiar with it.
Yeah.
So I have personally tons of questions about how it can be used and whatnot. So that's good to know that if you use a good company, they will kind of walk you through it.
Yeah.
That's helpful.
Yeah.
Back to perio. So I know you use lasers here as well. When your hygienists are treating scaling, replanings, perio maintenance, are they using ozone? Are they using lasers? Are they using both? What do you see as better, or do you prefer the combo? We kind of talked about maybe a combo earlier, so I'm assuming that's where you're going to go with this.
I mean, combo's going to be your gold standard.
Okay.
But it is, unless you're using a diode laser, right, which is really small and portable and inexpensive, but is a little bit more of a hot, not quite as beneficial laser.
Right.
It's hard to have that accessible all the time for hygienists.
Yes.
The ozone is really easy to make accessible all the time.
Yeah.
So that's what we use more widely.
Okay.
And then kind of more as needed, we would use the laser.
Okay.
So if we have an unresponsive area, if we have a bigger pocket, that's when we would use it.
Okay.
Yeah. But the ozone, we even love it for, the patients that need pre-med, but maybe don't want to take it, or we're thinking, why are we doing this? Antibiotics, right? We can even do the insufflation before, so that you're killing the bacteria in the sulcus before you go in and start debriding.
Yeah, that makes so much more sense.
Right? Yeah. So
the stuff we don't think about. I'm just, obviously it was just scaling, root planning, right? And then it was, I'll throw some Aronson in there.
Yes.
Which I never found good results from personally. I just never, I felt like it was too expensive. Most of it gooed right back out. And it just, people would come back and they're 6 weeks or whatever, and I never saw good results compared to, like, if I did one side with Aronson and one side without, I'd have pretty much equal healing on both.
Right.
And I went, why are we doing this? And then they started lasers. I've sadly never been laser trained, but that seemed like a gimmick at first to me, because lasers, they were using lasers for everything for a while there. It was kind of the thing.
Yeah.
It became a trend. And I hear better things now about lasers and how, they're actually working, which is good.
Yeah.
And then, I feel like maybe this is the next step, but I think you're right, where this should have been the previous step, and then we add in lasers.
Right.
And whatever else comes next technologically.
Right. I mean, it's a little more simple, a little less expensive, right? So easier to just use.
And it's so natural. Like you said, it's oxygen.
Yeah.
It's superpowered oxygen. And the body responds really well to that. I have a niece who got Lyme disease at 2.
Oh, geez.
Hiking. And so they have a hyperbaric chamber in their basement now. And wow, that thing works on her. It's just amazing.
Yeah.
And who would have thought? Hey, Yeah, oxygen is incredible stuff, and as far as cancer treatments and all that stuff go, cancer doesn't survive with oxygen around.
Exactly.
Oxygenate your body, and so I'm loving it. I think that's such a great idea. So if you've enjoyed this and you've learned something, and you want to maybe bring this into your office or at least do more research on it, how would somebody get started using ozone in their office?
The easiest way is probably just getting it in the water, right? We use it in all of the Cavitron water.
I noticed that this morning. I
Yep.
didn't realize that last time I was here that, you put it in the actual lines.
Yep.
No, they can't taste it. They can't seem to taste it.
No.
Nobody said anything about, oh, the water tastes weird, or, which they sometimes do if you're using the blue tabs or some of these
Right.
others. They go, this tastes kind of chemically.
And it's kind of soapy or like
Yeah.
bubbly.
Yeah.
Yeah, you don't have that at all,
No.
which is nice.
Yeah, I didn't notice anything. It acted like water, but yeah.
Yeah.
So it's nice to know I'm cleaning it with Ozone as I'm cleaning, and then you can go back and treat it as well. It's really cool.
Yeah, so you're flushing it the whole time, and that's easy. And we use it same, like when we're doing restorative, it is in our lines, so we're cleaning with it the whole time. But yeah, I think just doing a training, doing like a 2-day course, it's not that long or complicated. The machine, I wanna say the investment might be around $2,000, maybe less. For dental
Plus the
equipment, it's crazy.
Like, sensors are so expensive.
Exactly. Yeah.
Yeah. Okay.
So
totally doable.
Yeah.
Very affordable.
yeah,
Let's do this, guys.
totally. I was a little scared at first for just doing something different. But you explain it to the patients, they understand it. It breaks down in its oxygen, right? Like it's
Right.
not toxic.
Well,
We're not.
Your office gave me, the sheet that you guys give out.
Yeah.
The double-sided sheet. It's very comprehensive. It totally made sense. I went, I would totally agree to this as a patient.
Yeah.
And the other thing I noticed about working in this office is they have really no bloody prophies. Like it's
Right.
not a thing here. Like you guys have really clean. Everybody's gums look fantastic. I was getting 2s and 3s all day.
Yeah.
And you just don't see that in most offices.
Right.
But your hygienists just absolutely stay on it. And then with the Ozone and whatever else you guys are doing, I noticed, over by your front desk, they have this big cabinet full of amazing stuff. There's all kinds of, there's charcoal.
Our goodies.
There's all kinds of really great stuff over there. And, I like that you're, it's not just here's your Paradex, but here's also other options too.
Well, yes. Our approach again is like, can we get to the root cause, right? Which is potentially plaque, partially, but also, the health of the patient,
Dietary.
the diet, right? Are they breathing? What's
breathing?
right?
Are they? Yeah, absolutely.
So it's amazing when you see patients who are, approached that way, how healthy they really can be.
Yeah. Yeah, no, I see people all the time, and I'm like, man, I wish I could get them up here.
Yeah.
There are patients where, you look back at their chart, especially as a temp, because they're not my patients, they're mine for that hour.
Right.
But you look back at their chart and you go, they've had these 4 to 7 millimeter pockets for years now, and nobody's referred them out, nobody's done anything, nobody's sat down and talked to them about what are you eating, what are you drinking, what kind of meds are you on? Like,
Right.
nobody talks about that kind of stuff.
Right. How are we going to kill anaerobes in a 7 millimeter pocket?
We can't.
Well,
But we can.
but we can.
It turns out we can.
Yeah.
And traditional dentistry will say, well, we're going to do a flap and we're going to clean them out, and that's the only thing we can do. Well, that's super expensive.
Right.
But
Yeah, if we can prevent that for our patients,
Yeah.
or if when they're doing that, if they did it in combination, that'd be amazing too.
Yeah.
Yeah. Which we have specialists who are super interested in it. So it's good to see that, they see our patients, they see the same thing.
Yes.
And they're like, what are you doing over there?
Yeah.
What's going on? I want to see
Yeah.
how that works. So, yeah.
Yeah, I wish you need like some kind of open door rotation where people can come in and kind of watch and talk to your patients, because it's fascinating. The first time I walked in here, I didn't know that biological dentistry was a thing.
Right.
I had no idea. I'd always had this feeling, because my mom's a nurse and she tends to lean more natural with her stuff. Use antibiotics when you have to.
When you have to.
If you can beat it in other ways, let's start there.
Yeah.
And that's always the philosophy I've had about just general health. But dentistry's always kind of bothered me, just kind of in the back of my head, where there's got to be something more. There's got to be
Right.
something more we can do. There's got to be something healthier. We're missing something.
Right.
And yeah, I think, bringing in more of that naturalistic medicine is probably what we're missing.
Right. And just that education, right? That it's not just plaque.
Yeah.
It is not just plaque. We all know that. You're a hygienist. You know it's not just plaque.
Well, and good proof of that, I have patients come in all the time. You have your brother and sister, right? Same genetics, same food in the house growing up. Girl brushes her teeth, flosses all the time, gets cavities
Yep.
all the time. Brother hasn't brushed his teeth in 6 months.
Right. Yeah.
no cavities.
Right.
And they always go, why is that? And I go, I don't know.
I know.
You
Well,
know? We're missing something.
Yeah.
Like, what are we missing?
Microbiome, are they oral, are they mouth breathing? Are they nasal breathing?
Right. What's the pH of their saliva?
What's the pH? What's their gut health? Are they digesting fat-soluble vitamins?
Right.
I mean,
you
it's
got female hormones versus male hormones.
Yeah.
There's so many different things that we never talk about. It's
Right.
just like, well, you've got bad luck or you have your dad's teeth.
Yes.
I hate that.
Right.
I hate that.
I know.
It's not true.
Right.
Well, your mom sucked your pacifier, ergo you got soft teeth.
Right.
It's not a thing.
Right.
Like, she may have introduced bacteria into your mouth, but that is not
But why are they taking over?
everything. Yeah. Well, thank you so much. This has been
Yeah.
super interesting.
Yeah.
I hope you guys enjoyed. Please like and subscribe. More videos coming soon. And thank you so much, Dr.
No problem.
It's great to be here, and I hope to come back soon.
Thanks for coming to help us today.
If you guys have any questions, leave them below. If I get any good questions, I will totally come back and ask her. So if you'll let me.
Sounds good.
Okay. So thanks so much. Take care, everybody. We'll see you soon.